arrest about 90 people from Togo and Benin. All these do not help us, and we think there must be a change.
Mr. Osei Mensah was however hopeful that the Kumasi Metropolitan Assembly and the traders will adhere to the limited trading activities until the markets become fully operational.
There have been calls by Ghanaians who've had their lines disconnected by the Ghana Water Company to reconnect them. This follows President Akufo-Addo's announcement that the government will foot the bills of Ghanaians for April, May and June. We have on the line the Managing Director of the Ghana Water Company, Dr. Clifford Brima, to respond to these calls as well as other issues that have arisen. Good evening, Dr. Brima.
Good evening.
Now, persons who have been disconnected from your source are asking to be reconnected. Your response?
That is not a big issue. Who Ghana Water Company, then we followed for them to pay. If they are unable to pay, we then disconnect them and then ask them to come and pay. Then we reconnect at a fee. But people also owe, and we don't disconnect because of the levels of the. And so immediately the president made a pronouncement. We will have to obey immediately that the arrangement after the 3 months. And that is where the issue is. It's too interesting to know that it is not everybody disconnected that is as a result of non-payment. Some are illegal connection. Some will come and say they are taken for domestics. You end up selling tankers. And we have a number of them, number of issues. So we cannot give a blanket connection for everybody. So we are asking that people should get to the districts, get to the regions. Then the regions will look at their cases as individuals, then take a decision with them and get them connected when they need be. Because we went somewhere, somebody has connected our line into a reservoir that we don't expect. The person, you cannot say you are going back to connect to the person. And even those that we are going to reconnect, the indebtedness is not clear. We are just doing it temporarily, so that after the 3 months, we'll still go for the money that we will have to owe. But at the point, there was this communication indicating that Ghana Water Company says, or the MD says, people who owe Ghana Water Company will not benefit. And that was not the correct story. A lot of people who ask, but we haven't disconnected them. The issue is those that we have disconnected before the president gave the directive. That is the issue that is in contention. Those that we have not disconnected, we will not disconnect anybody. They will get their water as they do. Even areas that we haven't covered, we've made arrangement with the ministry to get tanker services to them, and we are putting polytanks in some strategic areas where the tankers will fill those tanks and people can access. People will have to call the various districts, they will call the region, then the region will get in touch with the tankers to serve them. And we are also saying that there are some landlords who take money from their tenants, then pay Ghana Water Company. We are no longer going to send them bills and take money from their tenants.
Dr. Brima, we hear you on that, but you're saying that we need to go to the district to find out who was disconnected for what. How soon? Because I'm sure for many people, since the president made this announcement.
Yes, from tomorrow they can begin to go there.
And so how soon do some of these people expect to have their taps flowing?
No, if your disconnection is not based on illegitimate use of our water, then it should not be a difficulty for you to arrange with the districts. Probably a payment plan, let them know that it's not because you are running away, but you also want to have this water. Then the arrangement is done. But the district will look at each case by case. Because if you were connected as illegitimate, and you will have to get through back, not at all. That would be a difficult. So we expect them to get with our districts to get those problems resolved.
Sure. Now we all know that in some areas the water doesn't flow because they are not connected to the GWCL. So there are people who sell, So now in this instance, there's been fights between those who sell and those who buy. Is it legal at this time to sell water for people who don't have water flowing through their taps?
Ghana is divided, as far as the water sector is concerned, Ghana is divided into two. One area is the urban areas, the other part is the rural and then the small towns. Ghana Water Company is responsible for the urban centers, and Community Water and Sanitation Agency is for the rural and then the small town systems, depending on which area. But the two agencies have been brought together by the ministry to make sure that we implement the directive of the president. But we are going further to say that areas that we do not have and they are peri-urban, like within Accra, areas where we have some challenges, we are going to erect these polytanks. The regions have started bringing, now if you take the Dansuma, Accra West area, they've requested for 30 tanks, polytanks, which we are going to give them, and then the tankers will be supplying the water. So those areas that are not connected, we will do our best to make sure that the polytanks are erected there, then the tanker services will put water there for them to come and then get water. We cannot let people be rushing on the tankers because we might not be obeying the protocol of the social distance. But if it is in the polytank and they come to draw, they can space themselves accordingly and get the water and go.
I was going to get to the Accra West issue because I know for a fact that in part of Accra West, the water hasn't been flowing regularly since 2019. Are you saying that the tankers are going to go from house to supply water? How does that work?
Go to house to house. They are going to be communal. They are going to place polytanks at some vantage points where the tanks will be filled regularly. We get the tankers to regularly go there to fill, then people can walk there, get the water and go home.
But in such an instance, won't you have problems with the social distancing? Because it's likely that people are going to rush to get water before the tankers run out of water.
We need to have attendance at those places. So we are working through the assemblymen to make sure that those things are gathered properly.
Now, there are communities that have no access to potable water. How do they benefit from this?
That one they will have to get through the whole country is divided into a number of districts, and so they will have to get in touch with their district, either the district assembly. Then they will now call. If it is under Ghana Water Company, then we come in. If it is community water will come in. We are all getting our systems in place to make sure that we satisfy the directives.
Dr. Clifford Brahima, Managing Director of the Ghana Water Company, thank you for your time. Hey, we all like free, so we're hoping that the water will flow for free. Now, in our next story, some deprived communities in the Ningo Pram district of the Greater Accra region have received relief items to help them cope with life during the partial lockdown. The items were presented by the DCE, Mr. Jonathan Teidoku, and B5 Plus, a manufacturing company.
The presentation of assorted items, including food and toiletries, was a relief to residents of Ningo Pram, who say the closure of businesses, shops, market centers, and restriction of movement in neighboring communities such as Tema and Asharman have affected their economic lives since they plied their trade in those locked down affected areas. About 500 deprived households in Ningo Pram, Chopoli, Lapleku and Dawenya benefited from the gesture. The benefactors were the DCE of Ningo Pram, Mr. Jonathan Teidoku, and the B5 Plus company. The beneficiaries were grateful. The managing director of B5 Plus company, Mr. Mike Takwan, said to ensure that hospitals have enough oxygen in this time of COVID-19 pandemic, authorities of the various hospitals in the country should visit the B+5 company site at Boom near Tema with their cylinders to take free oxygen for effective healthcare delivery.
And to the Central Region now, the Ghana Health Service has confirmed that Cape Coast in the Central Region has COVID-19 case. This means positive cases have now been confirmed in the Greater Accra, Ashanti, Eastern, Northern, Upper Western, Upper East and Central regions. According to Ghana Health Service, the patient arrived in the country from the United Kingdom on March 17, 2020. About 13 contact tracing have so far been isolated. The Ghana Health Service says the patient was identified through the ongoing enhanced contact tracing exercise. We go over now to our Central Regional correspondent for more details. Kingsley, good evening.
Hello.
Yeah, what's the latest in relation to this matter?
Well, what it is that this afternoon there was a rumor on the internet that this has happened and that the Central Region has recorded its first COVID-19 confirmed case here. And so we quickly had to do a follow-up at the Regional Health Directorate, and it was confirmed that this man returned from UK. He's a Reverend Minister, returned from UK, and that is when he arrived, that was the 19th, they prompted the health officials, so they went for the sample. So it was part of more than 100 cases that have already been sent for confirmation. And of course, this afternoon it came that yes, the man is also has contracted the infection.
I say, so what's the mood in the Central Region with regards to this kind of discovery that one person has tested positive?
In fact, it has come with some shock, and people are panicking now because of the way and manner the information came out. We initially, I think that the health officials wanted to relay it to Accra so that maybe during the Ministry of Information the update, it will come up so that they will know how to manage it. But the way it came, according to health officials that I spoke to, the man was even somehow getting angry because he was home when the people started calling him that, hey, we have told that he's been confirmed and so on and so forth, because the information that was linked to the media came with the location of the man, his age and where he came from, and the Reverend Minister and the vicinity in which he lives. So definitely the direction pointed to his house. So the house people and the people in the area got agitated. So the man got information and his confidentiality and all. They are ethical contact tracing, but of course they are working on it. So they have to. It looks as if somebody within the team, the COVID team, released it to the social media. But it was confirmed to us that yes, indeed, the man has contracted it and that they are working. So when you get to town, where everybody is now becoming alert. Also, initially, people thought that it is far from us. So even the social distancing and all of that, they are adhering to it. But there were some careless people around who perhaps decided that what it is happening and they have not received. But now that it has come, it has been confirmed that we have one, people have become more alert and probably cautious with regards to what we just had.
It's good to hear that people have become more alert now, but then generally, how is education going in terms of the people's view of the coronavirus disease in the Central Region, Cape Coast specifically?
Well, I must say that the education has gone down. People have been sensitized, health officials, the media. In fact, let me just put in that just the health officials of both the media, people together from 25, GTV and all of that together to even educate us as to how to properly report on this issue so that we don't create fear and panic within the system. So by way of education, I think that it has gone down well, but it was because we have still not reported the case here or had a confirmed case here. So they thought that, well, the use of it is far away from us, and people were not taking it so that they were joking with it, even though they have the information and they have the message. But now that this confirmed case has happened, I was around for the Kwaba getting some short and talking to some people, and they say, hey, now it has gotten to us, so we need to be extra vigilant and extra careful. So that is what, but for the information, they have it, the education, they have it. They just need to perhaps comply and just stick to it as being told.
All right, Kingsley, thanks very much. That was our correspondent, Kingsley Nanabudu, in the Central Region, Cape Coast specifically. Now to our next story. The President, Nana Addo Dankwa Akufo-Addo, on Wednesday afternoon met with leadership of the country's health service providers. President Akufo-Addo said the overall safety and lives of the health professionals at the forefront in the coronavirus fight is of high priority to the nation.
The leadership of the Ghana Registered Nurses and Midwives Association, the Pharmaceutical Society of Ghana, Allied Health Professionals, Ghana Association of Certified Anesthetists, and the Ghana Physician Assistants Association met with the president. It was an opportunity for the government to commend them for their untiring efforts in the fight against the coronavirus. The health workers also, after commending government for decisions so far taken in curbing the spread of the virus, also asked government to make good promises for adequate PPEs. Since the president last addressed, the issue of who a frontline worker is has gained attention, and this came up during the discussions. Leaders of the various groups made cases for their respective groups.
All nurses and midwives are frontline health workers. Every nurse everywhere is a frontline health worker. And like I said, right from the teaching hospitals to the regional hospitals, to the district hospitals, to the health centers, to the CHIPS compounds, all these cadre of nurses and midwives are frontline health workers. We have been frontline health workers since time immemorial.
We want to applaud and commend Mr. President and your government for the bold leadership decisions that have been made before and even during this COVID-19 pandemic era. These are not easy decisions to take, but you have sealing all our borders to limit importation of the virus, the lockdown that we are in now in critical areas, incentives for frontline staff, businesses, and the vulnerable, and particularly governmental briefings, and your own, Mr. President, your own addresses of what I call the addresses of comfort that come to us from time to time.
President Akufo-Addo said although the definition of a frontline worker is vital, the safety of all health workers is equally very important.
It's not an attempt to demotivate, but a recognition that in the risk structure in the health system, there are graduated risks. And I think that you yourselves have been honest enough to say so. And the attempt to make this definition was to respond to that graduation. And the argument that has been put here, even by the president of the Nurses Association, yes, we think that there should be a 35% allowance across the board for all nurses, all health workers, but we recognize that certain particular health workers would need an additional amount. And I think that has been reiterated virtually by all those who have spoken. That is a recognition that there is such a group of people as frontline health workers, and yes, and it is the argument in itself tells us that there is.
The meeting was part of government's broad consultations with all players in the health sector as it pools views and ideas to minimize the spread and eliminate COVID-19.
News are live from our national studios, GBC News and GTV.
We're going for a short break, but we come back with
The Finance Committee of Parliament has approved an amount of 1.2 billion Ghana cedis from the contingency fund to be expended by the Ministry of Finance. The amount goes into the COVID-19 alleviation program earmarked for 3 categories of people: households, frontline workers and micro, small and medium-scale enterprises in Ghana. Earlier at an emergency sitting on Wednesday, the Minister for Finance, Mr. Ken Ofori-Atta, requested for Parliament to grant him the right to access the fund.
Mr. Speaker, thereafter on 30th March 2020, the Minister for Finance delivered a statement on the economic impact of the COVID-19 on the economy of Ghana to Parliament. The Minister also placed before Parliament a proposal that sought parliamentary approval to lower the cap on the Ghana Stabilization Fund, GSF, from $300 million to US $100 million, and to transfer the excess amount of $290 million over and above the newly proposed cap to the contingency fund to finance the coronavirus alleviation program. Mr. Speaker, I wish to express our profound gratitude to Parliament for working expeditiously to approve the proposal to lower the cap on the Ghana Stabilization Fund from $300 million to US $100 million. This has enabled us to transfer the CD equivalent of $219 million, that is Ghana 1,203 million CDs, into the contingency fund.
Again, let us all avert our minds to Article 1771 of the Constitution. What we were required to do this afternoon was to determine whether a need has arisen. And if a need has so arisen, then we authorize expenditure. Okay, this is not the normal approvals we give when we go through appropriations. That is why this is an emergency, which is referred to the Committee on Finance, because the Constitution envisaged that in such an emergency, you don't need to go through all the motions and come to the full house. That's why it says this small committee of 25 should authorize the spending. And then the minister will come back, having spent, to brief the House of all the details. So if at this point anybody is asking that who are the people going to benefit from the Ayalolo 2 million, it is premature.
Now, on the part of the minority caucus in Parliament, the Finance Minister must appear before plenary again for the House to approve the request. Also, a bipartisan committee should be set up to manage the food distribution exercise for households under the partial lockdown and electricity subsidized for residents in lockdown areas. But the majority says government has its own plans on how to manage the stimulus package.
The tax waiver will only be given to government workers, health workers. So if you are a private health worker, you are not covered under that. And so we insist that that should cover all health workers, not only government health workers. The minister informed us that an amount of 600 million Ghana cedis will be used as soft loans for micro, small and medium-sized businesses. Again, they failed to give us the terms of the loan, terms of recovery, and who qualifies to get that loan.
Yes, I think the health minister yesterday told us at the press briefing that they will make sure the private health workers are included. So I believe from here they will put in the plans to make sure every health worker, because we know that they also play a bigger role in the COVID-19 fight. If you check the figures, they are even identify most of the cases. So I think it is in the right direction to also motivate them so that they can also give up their best.
Now, by their own estimate that they presented on 30th March, they required 562 million for their COVID eradication program. Now, if you look at what the Minister of Finance have done today, I'll come and I'll respond to the President's addresses to the nation. You have food packages and hot meals, 40 million. Support to households, 280 million Ghana cedis. Which household and to which family? How was it determined? A need or a means test? We need to know. And we are demanding that COVID be handled above partisanship. Now, when you say provision of water and sanitation, 200 million, we are told that we are not to pay water bills. So what is that provision meant for? Is government going to cushion with that money of 200 million? Is it going to Ghana Water for purposes that citizens will not pay.
As for the hot meal, about 250,000 people have been identified, 150,000 Greater Accra and 100,000 Ashanti region. They are the ones that are going to benefit from, and they've told us in terms of how the distribution of even the hot meal and the dry food, NADMO, and we are going to use faith-based organizations. They already are into this kind of, so we are going to use them. The president have a clear vision. He doesn't want to make this look too partisan. Where people play politics with it.
Moving on, the Ghana Chefs Association has extended a hand of love to the staff of GBC News and Radio with food packages. President of the association, Mr. Isaac Saki, said the gesture forms part of efforts by the group to support the media during this period of partial lockdown due to the COVID-19 pandemic. On arrival at the broadcasting house, members of the Ghana Chefs Association went through the COVID-19 ritual of hand washing. From there, the team proceeded to the newsroom and interacted with the staff.
Joe Vansan, Goba, Enoch, and GBC News. So you know it. Yes.
The Ghana Chefs Association, since April 1, 2020, the partial lockdown reached out to thousands of Ghanaians in Accra with hot meals. Dubbed Cooking to Save Lives, about 10,000 people have been impacted positively by this project. The latest group to benefit from the Cooking to Save Lives project is the staff of GBC News and GBC Radio.
Organizations like yours do not step up to help, and the pandemic spreads, it will consume all of us and our organizations will not even exist. So for the Chefs Association, as small as you are, to be able to do this, we expect that the giant corporations, medium-sized industries, and even small-scale ones will emulate your gesture.
The president of the Ghana Chefs Association, Mr. Isaac Saki, described the work of the media as crucial to the winning of the fight against the COVID-19 pandemic.
We know how GBC is very important to the nation as well as the staff and everything. So today we said we need to come over to come and give you a lunch pack so that the staff and everything, those working on this difficulty time, can able to have access of food.
Now on the interbank market today, the US dollar is trading at 5 cedis 50 pesos to the local currency, the pound sterling at 6 cedis 75 pesos, and the euro at 5 cedis 95 pesos. And that's it for business. We have more news coming up. Please